So for the longest time, the associations would say it doesn't come out, there's no danger, or if it comes out, it's a type of mercury that is not an issue. But technology has come to a point where we can see the amount of mercury off-gassing even after 40 years from those fillings. And there's no amount of mercury that's safe.
Are your teeth toxic? It's not a trick question, but it is a serious one. Because what is going on in your mouth could be keeping you sick and tired. And I'm here to tell you it does not have to be that way. Trauma and dentistry is something I know a lot about. From dealing with my own painful jaw surgery as a kid, to the recovery, to countless visits to the dentist and the orthodontist that would put anyone in a state of stress. I wish I had the knowledge of how holistic dentistry could have helped me many years ago. But I'm here to tell you that there is help today. And if I can spare you the upsets, the traumas, the pain, I'm going to do my job well. Just like Dr. Pascal Nguyen. Dr. Pascal is not only a holistic dentist, he is a naturopathic doctor. And during our conversation, he shared his own childhood trauma that made him think twice about his own health and how he can serve others. How he has made it his mission to help his patients have healthy smiles, but also live long and live well. From knowing the dangers of mercury fillings, to understanding your biological age, your heart rate variability, and why material biocompatibility testing can make a difference the next time you sit in that dental chair. Plus, the link between saunas and dementia, something I didn't even know about, and how he will help you find the best holistic dentist in your area just by tuning in. We're giving you something to smile about here on this episode of HIListically Speaking. Dr. Pascal, what a pleasure to have you on HIListically Speaking. This is a topic I have not covered, and I'm kind of shocked I haven't because of my own trauma and background, having a temporomandibular joint disorder, going through the surgery myself, and really working in the trauma space. So I'm really excited to have you here to share more about what you do as a holistic dentist and also a naturopathic doctor, and really share with the listeners about what it is you do and how you're serving the community. So thank you for being here.
Thank you, Hilary. It's a privilege. When I was looking over the kinds of things that you do, it's like what we talked about a little bit earlier. It's right up my alley as well. I love your approach to improving people's health and kind of how they deal with life. And yeah, I think we'll have some great things to talk about.
Definitely. And I will just say right off the bat, you're the kind of doctor that I love to work with. Being a health coach as well, I think it's really important for people to understand where health coaches come from and what we actually do. And a lot of times we align ourselves with holistic practitioners and doctors and dentists who might not have all the tools to be able to support their patients. So we work so well together and align with health coaches and holistic practitioners to be able to support people as a whole, as the word holistic means. So let's just get right into it. I'm really curious about how you got into this work, going to traditional medical and dentistry school. How did it come about for you to go that route?
Right. So basically, I had a trauma when I was young. I had a very, very severe allergic reaction to a cat, and I got sensitized to asthma, breathing well, not breathing well. I came from a rural area where it was actually a cool thing to smoke, and if you didn't, you weren't part of the gang. And even as pretty young, but even as an 11-year-old, I knew that I had to be careful. And it just kind of stuck with me from there. When I got into dental school, I got exposed to doctors that were doing kind of pioneer work in removing silver fillings, which I call mercury fillings, from the mouth. And I just instinctively knew then that it didn't make sense to put things that had mercury. And this was a while ago, and now they've finally shown, yeah, it's true. You shouldn't have this in your mouth.
And isn't that traditionally what people get? They get the silver fillings.
It's less and less, Hilary, but it's still almost 50% of dentists that place that.
Mm.
So yeah, it's pretty common, and it's not good.
So your trauma as a child being having an allergic reaction to a cat, how exactly did that lead to what you're doing?
I remember, I was like 7 years old, and I was sitting in a bed, hunched over, try to gasp for air, and there was
Mm.
nobody around to help me. I thought I was gonna die. So that was my trauma. That was my marking moment for, okay, I have to take care of my lungs. I have to take care of my health. And I didn't know how that was going to turn out. I didn't know what was going to be the outcome, but I had a little leaning towards, you got to be healthier.
Yeah. It's interesting when things hit us at such a young age. I think about my own traumas that I was young when I experienced my first trauma, because they say that there's the original incident. We
Mm,
learn a lot about that in the
mm,
trauma-informed space. And so you have your OI, and then you might have a series of traumas that impact you as you go on in life. And with that, I think we become more self-educated and informed, where we think we're either going to go one way, we're just going to poo-poo it and not do anything about it and live life this way, or it's going to impact us and we become aware of it, so that how are we going to live our lives powerfully? And it seems from those kind of things that happen, not that
mm,
we wish trauma on
mm-hmm,
on ourselves, it's a lesson and a learning
mm-hmm.
to show up differently in this world. So
Yeah.
by doing that, and going into the holistic and naturopathic space, how has that impacted you?
So, as I'm sitting here, I'm kind of feeling how I am, and I'm a little kind of warm because I came out of a sauna. I have a red light in my sauna. Um, I feel better than I have felt almost in my 20s and 30s.
Hmm.
I'm in my 50s, and I have looked, and I'm turning every stone over that I can to biohack my life, my well-being, my performance. So it has all led to that. It's become a passion. I've actually opened a wellness center that do these things: cryotherapy, cold therapy, hot therapy, red light, IV therapy, and it's just who I am.
Oh, you're living your truth.
Yeah.
And I think in my mind, a lot of times it's when we find that space that makes us feel better, especially when we're in the work of service like we are. You want other people to feel that. Don't you? Do you get that sometimes? Or it's just like, I want people to feel as good as I feel. How do I do this? You
Yeah.
know,
Yeah.
it really comes down to being of service. So tell me about the wellness center.
Oh,
You're in
yes.
Oregon, right? You're in Oregon.
We're in Portland, Oregon, yes. My dental office is a little south of Oregon, and the wellness center is an area called Lake Oswego in Oregon.
Hmm.
But I teamed up with a medical doctor that is like-minded to me. His
Hmm.
space is into detoxing people, but I do it in the mouth. He does it for the whole body.
Hmm.
And we just do these things for our patients. And we thought, we gotta have somewhere where people can have an alternative to medication, to surgery, and
Yeah.
just improve their performance, their well-being, sleep better, more mental clarity. And we came up with a set of modalities that do that naturally, and
Hmm.
we implement there. I go myself like 3-4 times a week just to benefit, but it's really awesome.
I imagine I imagine it's touching a lot of people in a positive way. And let's I want to talk a little bit about what you mentioned before about the fillings, because I think that is
Hmm.
if we're going to talk about the topic of dentistry and toxins, I really would like
Yes.
to go there. Um,
Okay.
let's go and talk to me a little bit about that.
Right. So um, the silver fillings are over 50% mercury. And, there's debate in the past about the mercury that's in there. The mercury is used in those fillings with other metals because when we make a filling, we have to shape it to the tooth. So when we get the material from the company to put these fillings in the mouth, they're like in a powder form. We mix that with mercury so it becomes kind of shapeable. And then we pack it in the tooth and it sets and then it becomes like a hard metal. So for the longest time, the associations would say it doesn't come out, there's no danger, or if it comes out, it's a type of mercury that is not an issue. But technology has come to a point where we can see the amount of mercury off gassing even after 40 years from those
Mm.
fillings. And there's no amount of mercury that's safe. Like if someone breaks a neon bulb or neon light, that has mercury in it, people will be evacuated from the building immediately, and it'll be treated like a major contamination. When I don't buy it, but when we buy those silver filling, let's say a box of those materials to put in your mouth, it comes with the skull and the bones on there saying it's toxic. When we
Mm.
take that out of the mouth, and the Environmental Protection Agency, the EPA, tells us we can't put that in environment because it's toxic for the environment. And yet in between, it's supposed to be okay. So not everybody knows about this. Most of the clients that come to me to get that out are clients like we talked about earlier that I've seen other doctors and they're having some health issues. They're having things like brain fog, sometimes neuropathies, just low energy, you know, different conditions they can't get over, they can't get better. So they come to me and we remove those safely. We have a very strict protocol so patients can't breathe that, they can't get those fumes that come out when you drill it fall back on them. We build their immune system before they go through that procedure. We give them binders so if something was to sneak in, it's bound and it comes out. And then the other side of that is we put material that have been selected to be biocompatible for them. More and more these days, we're seeing allergies, we're seeing immune overreactivity to, you know, even to the own body, I'm pointing to the thyroid. Hashimoto was like a problem that wasn't around like 30 years ago. Now I see it every single day. Your own body is attacking its own parts. And, part of that is some of the traumas you're talking about, what
Mm.
happens during a trauma, like parasympathetic goes out. Our
Mm-hmm.
digestion doesn't work and, our guts are messed up, like the microbiome. Anyway, I diverge a little bit, but the mercury fillings are a big deal. Also, I would add that the FDA finally put something out supporting that, saying that it's not recommended that we put that on children, women of bearing age, obviously not
Mm.
pregnant, people that have neurological issues, obviously if you have allergies to mercury, and kidney issues. And if you
Mm-hmm.
tally all that up, that's 50% of the population. So it's on its way out, but it's not a good thing to have in your body.
I was just going to ask you about that because and I was thinking about women who are childbearing or looking to get pregnant. One of the things you're supposed to stay away from is fish and with high levels of
Exactly.
mercury, anything. And here we
Exactly.
are putting this close as we possibly can to our body. It's touching our nerves. It's going
Hmm.
all through our body in a way, and yet it's okay to use in a medical setting. And I imagine um, that could really be a serious impact because you're now attaching it to your own body and chemistry. So what is the alternative? Is it ceramics?
Yeah, ceramic. So the ceramic is a great alternative, but it goes by size. If it's
Mm-hmm.
a very small filling, a ceramic, has to be shaped. The advantage of the ceramic is that it's a material that's been done, kind of chemically reacted outside of the mouth. So there's no more reaction happen once it's in. The alternative is what we call a composite, which is a type of plastic.
Mm-hmm.
And we have to put that as a paste in the mouth, and then that has to set. And so people need to be careful because some of them have BPA, and as you probably know, BPA's mimic
Mm-hmm.
estrogen hormone. So we want to limit BPA exposure if we can. So there are composites now that do not have BPA, but the ceramics definitely don't. The ceramics are closer to the tooth in both structure, wear, flexibility. So generally
Yeah.
speaking, it'll last a lot longer. Because the other thing we want to be careful with is once you put a filling in the mouth, they don't last forever. At some point, they most
Mm-hmm.
likely will need to be changed. And every time you change it, because it becomes bigger and it gets closer to the nerve, and it can get to a point where it can infect the nerve, and then it turns into root canal, crowns, and other problems that we want to avoid. So if you can put a ceramic that kind of prevents you from having it to the filling having to be replaced for a longer period of time, it's better. But
Yeah.
ceramics have to be bigger, so you don't want small fillings out of ceramic.
It seems that each one has its positive and negatives. I mean, I've had both the silver, I've had
Yeah.
the ceramic, I've gone back to the silver, I've gotten the crown,
Hmm.
and it's trying to really find a balance to what's going to work best for me
Hmm.
and my body is bio individuality, right? So it's
Yeah,
talking to your doctor, it's talking to your dentist, and making the right kind of decisions that's best for your health. Absolutely. Yeah.
exactly. Yeah. If someone is healthy,
Hmm.
it's not as big of an issue. Another thing that I do in my office that's not generally seen is material biocompatibility testing. So if someone has allergies, like a lot of people have gut issues, meaning
Hmm.
their immune system will be a little bit wonky, let's say, and they
Hmm.
can react to materials more. I can test for which material is suitable for them and tailor those fillings for them.
That's a level up. You don't see that a lot of in a lot of dentist offices. That's great.
Yeah.
Talk to me about, this is an area that I'm familiar with, especially in my background as a havening techniques practitioner, and being that one of our co-developing doctors is a dentist. We talk a lot about the sympathetic and parasympathetic nervous system.
Hmm.
How is that something that you incorporate and really think about within your practice?
Right. So sympathetic overdrive is rampant like never before.
Hmm.
Generally speaking, not all the time, but when you're in sympathetic overdrive, I'm kind of assuming people know, but maybe I should explain that all our body's function are automatically controlled. You don't think about breathing, you don't think about your
Hmm.
heart, you don't think about digestion. It's automatic. But there's two sides to that. Sympathetic is fight flight. You're
Hmm.
afraid, you're running away from a tiger. It's no time to be digesting. Your pupils dilate so you can see and run. Your heart beats faster and your muscles get gorged with blood so you can do life-saving things. The thing is, when you're in that mode, you're not in the other side of controlling your body automatically, which is the parasympathetic. Parasympathetic is rest, digest, rebuild,
Hmm.
detox when you're sleeping, memory, consolidation. And when we're in that sympathetic all the time, your body becomes toxic, your body becomes stressed. And that stressor keeps you in
Hmm.
sympathetic, and it becomes a vicious cycle. It'll make your adrenaline go up, cortisol level go up, you won't even sleep as well, which that's when you should be in parasympathetic and cleanse more, detox more, and on and on. So in my practice, I check all my new patients, when they come in, to see where they're level at. There's a number called heart rate variability, HRV, which gives you a very good indication of sympathetic versus parasympathetic. And I could talk about this for a little while, and you can let me know if you want me to expound on that. But essentially, I want to know how long and how high my patients have been stressed, generally speaking, not just emotionally, because I'm going to inflict stress whether, I like it or not. Doing a filling, injecting, doing a surgery is a stressor. And if my patient is rock bottom as far as their ability to handle stress because they've had so much, I might be the thing that tips them over, and I don't want that. It's pretty rare, but I want to know. I've had a couple of patients where they're so low, I just send them back to their doctor and like, you need to bring that up. An example of that is kind of blood pressure. It's normal for everyone to measure blood pressure, and if it's too high, that next stressor could give them a heart attack. So it's kind of a little bit like that. But I also quantify where their stress level is at with HRV. And when I remove stressors, I can remeasure after, and I can show that it is now improved. There's less stress on their body. They're more in parasympathetic. So I'll get into discussions too about, obviously nothing like you with nutrition or trauma, but it's very clear, like if someone's not eating well, they're not sleeping well, they're overstressed, these are all contributing factors to a low heart rate variability. And then as a holistic dentist and a naturopathic doctor, I still want to have conversations with them, even if I'm not treating, to say, you gotta address at least let's say your sleep hygiene or different things like that. If your trauma is like, well, maybe you need to go see Hilary and, see how we can work through some of these trauma. You need to get past some of these things to improve your heart rate variability. And of course, nutrition. It's kind of funny because everyone that comes into my office say they eat super well. They all think they're eating fantastic, but when you dig in, it's generally not the case.
Yeah, I think a lot of people do think they eat well, and they try, and it's more
They
than just
try with
eating
what they
big.
know.
They try with what they know, and it's really just giving them more possibilities, right? And honestly, everybody, like I said, is different. It's bioindividuality. I mean, somebody might be allergic to celery, somebody might not be able to digest romaine. So it's knowing the person and knowing how different foods impact different people, especially if they're dealing with something like Hashimoto's or any kind of immune deficiency or chronic illness, or just life in general. It could just be it could be a simple, small thing that can make a difference. Even that can elevate the stress in the body, without them even realizing they're doing it. So I think it's really being your, I can't say this enough, and I say this all the time, that you have to be your own healthcare advocate first. You have to understand your body. You have to know it. And that's why we have professionals like yourself with what you do, with what I do, so that if people aren't informed, they can come and learn and be more informed so that they can hold space for themselves first. Then you go into a doctor's office and you're more informed, and you can have more educated conversations and have a better understanding of what you need to live powerfully. So understanding, I think the heart rate, the HRV, talking about that is phenomenal. I don't know. I mean, in the world of doctors that I'm around, that I align with, I see it more. But I wish more doctors were doing that, because understanding the stress level and the capacity of each of your patients is so vital, or they're going to walk in already feeling like they're going to be eaten by the tiger, right? The minute they get put back in that chair, I get like that too, doctor. Like I love my dentist, right? But I'm still thinking like that big thing with the sounds is coming at me. So I'm sitting there always havening. I have my headphones on. I'm like, I just don't want to know what's going on right now.
Just one more thing to add, Hilary, about parasympathetic there. It's you speaking about kind of a little bit of tension at the dentist. I use a device that stimulates the vagal nerve to deal with anxiety in my
Oh,
office. Basically, bioelectric therapy. You put these little earlobe attachments that stimulate a branch of the vagal nerve, and
that's
at
amazing.
least when they're there, it stimulates, the parasympathetic through the vagal nerve, and patients really like that.
That's a level up. That is a level up. I'd love to just experience that. I'm going to have to research that
Yeah.
more
Well,
because,
I can give you the links to that. I use it in my home because it's good for anxiety, but it's also good for PTSD, insomnia,
mm,
and depression.
hmm
And during this
mm,
COVID thing, my oldest daughter, she's 12 now, but at the time she was a little over 10. She had massive anxiety attacks. Like I'm talking, I would drive her to school and she would have a fit, crying, yelling, not
mm,
wanting to get out of the car to go to school. And my wife and I were so distraught because like that could be her life there. What's going on?
yeah.
And we did that therapy for her, and just I mean, it's not the only thing, but she is completely different now. She is like
That's great.
in student council. She's doing the plays. She's got friends. It was just an amazing turnaround. It's great technology.
That's amazing. And to kind of play off of that, there are so many different amazing modalities out there that can support
Hmm.
people. And as I always say, like put it in your toolbox. Sometimes you need
Yeah,
the hammer,
exactly.
sometimes you need the screwdriver. Like
Absolutely.
have more to use when you need. So whether it's, the device you're talking about for the vagal nerve, or it's havening, or it's meditation or hypnotherapy,
Hmm.
whatever it is, especially when we're talking about kids too, because I'm a college professor and I saw that a lot during the pandemic since we went online. And it's so important that we teach this next generation how to self-regulate, including ourselves. But if we can put more tools in the hands of these kids, how to the social
Yeah.
emotional learning tools, the self-regulation, so that they are more empowering themselves to know that they have the
Yeah.
tools to make a change and bring themselves down when they need
Mhm.
to. We're going to have really empowering adults, because we didn't have that.
I,
I mean, you were told to go to the guidance counselor or the doctor or detention or
yeah,
think about what you
that's
did,
right.
right?
Yeah.
So I think we're creating the space for that. Before we go any further, I just want to mention to those listening that this is Dr. Pascal. He is a holistic dentist. He is also a naturopathic doctor. I'm so elated to bring this conversation to all of you on Holistically Speaking, because there are a lot of questions many of you might have about your own health and well-being, especially when it comes to going to the dentist office and just all of the options that are out there. And Dr. Pascal has graciously offered to give away a free checklist, which is what to look for when you're searching for a holistic dentist. I'm going to put a link to that in the listen notes so that you have that available to you. And you can download that
Hmm.
and then do your research on your own, because, like I said, you have to be your own healthcare advocate first. So thank you again for being here. It's such a pleasure having you. And can we talk a little bit about when you're, I know what it is, but I'd love for you to elaborate on the biological age. You
Yes,
mentioned that a little bit.
I did. Yeah. So we talked a little bit earlier about heart rate variability, and most of us know our age by a paper, a birth certificate, but we've all seen someone that's 70 that looks fit. They kind of look
Mhm.
like they're in the 50s, or definitely younger than 70. And the other way around, someone that's in their 30s that have just been burning the candle by both ends, and they look really old, or they look fatigued, their skin's pale, different things. And you kind of know instinctively they're older than they actually are. And I've, um, so the heart rate variability is a measure of that. So that's another reason
Mhm.
I like this number, because if you have a good heart rate variability, even though you're older, you will live longer. Your heart,
Mm.
your body, your system is able to handle stressors. And, our body is not like, we live in this kind of world where there's a lot of comfort. You know, we have heaters, we have air conditioners, we have jackets and things like, but it was not always like that in humanity. In other words, when we're presented with a stressor, our body adjusts to adapt to that. And some of that is actually healthy. That's what hormesis is. For example, we go to the gym and we work out. That's a type of stress, a physical hormesis that will, if you do it in the right amount, enough, but not too little, not too much, your body will respond by making your muscles stronger. But there's others, there's temperature hormesis. We're familiar with saunas. Little anecdote here, Hilary, did you know if you go in a sauna 20 minutes 4 times a week, all dementias compounded will be reduced 55%?
Wow.
That's a
Wow.
research study. I can send you a link to that if you want, but I mean, that is pretty mind-boggling. But our body is designed to adjust, and if you give it the right amount of stressor, like going to the gym, you'll keep your body healthy. And if you don't do it enough, or if you do it too much, then and heart rate variability gives you that number. And that's why I consider it like an actual biological age. There's other ways to measure that. You know, actual age has been linked to telomeres at the end of DNA. So telomeres are little caps at the end of DNAs, and they protect it. And as the telomeres get shorter, DNA is less protected to a point where it might not do what it's supposed to as well. But anyway, that's just another way to measure that. And I actually use peptides personally to counter the effect of that. It actually makes your telomeres longer. But their biological age is not the same, and you can change that. For me personally, I'm looking to live really long and a really high quality of life. And that number, that biological age number, that HRV number will keep you on track to know if you're going to head there.
I couldn't agree with you more. I'm a huge fan of, and I'm sure you're familiar with the blue zones and living well into 100s. I had Dan Buettner on my show last year, and it was just such a,
Oh, really?
I mean, it blew me away. I mean, I've been very familiar with his work for quite some time, but the idea of living well into our 100s and living with that power 9, the 9 principles to live well, like not just live till 100, but thrive in 100.
Exactly.
I'm with you on that one. And there's so many things we can do. It can come down to just the accountability factor. I think is huge. Like I have an app on my phone that I check in every day, and they say, it used to be get on the scale every week or every month, but you really should get on it every day because it is the constant accountability, and not be so upset if it goes up or down. But one of the things on the scale I use is the biological age and the HRV. And I like to be able to check that. And like, if I see my age higher than my age is, I'm like, oh, something's amok. I got to take it down a notch. What am I doing? Is my stress level up? Am I not eating as well? And these small little variables and factors are things we can do for ourselves and not have to wait to the doctor to find out what's wrong. Right. So those kind of things can make a huge difference. And that's great that you bring that up. I love that you mentioned that. And again, if you're listening to Dr. Pascal talking about holistic dentistry, holistic health in general, like that's what we do here on Hilistically Speaking. And definitely, if you're interested in making some changes and transitions in your life, that could start with finding the right kind of dentist to support you. That free checklist, I'm going to put that in the notes. And if you are touched, moved, and inspired by this podcast episode, please consider passing it along, sharing it with other people. That is what we're here to do here on this show. I want to do a quick game with you before we close out. I love to do this with my guests. It's just an opportunity to see how quick that brain is. How healthy are you there, Dr. Pascal? So what I do is I put aside some words that you mentioned during our conversation. And then what I want you to do is just come back with the first word that comes to mind. So like word association.
Okay.
Ready? Let's see how well that sauna's working for you. By the way, before we go into that, I just want to ask you one quick question on that part. Is that something that could be reversible? Like if somebody in their 70s starts doing the sauna 4 days a week, is it something that can potentially reverse the effects of dementia or just slow it? I mean, I know we've heard a lot of theories about dementia and how you can reverse the effects.
Yeah, I wouldn't say that's a one thing, but I would say definitely would improve. There's a lot of types of dementias, but, I would think of it like in your brain, when it's not functioning, when it's not cleaning, when, there's cells in there that do cleanups, when they don't work well, when there's too much stuff being kind of accumulating there that's not supposed to be there, the brain slows down. We could just kind of call it like that. And when you sweat it out, those things come out. And when you get the toxins out regularly, then, your brain can clean better. So Great. I would say you can definitely get some improvement no matter where you're at.
Good. Thank you for sharing that. I meant to ask you that before. So, all right, here we go. One word, just come back as fast as you can. Okay. Toxins.
Fillings, silver fillings.
Allergies.
Gut issues.
Immunity.
Rampant problem.
I'll give that one to you. Stress.
Sympathetic. Overdrive.
Yeah. Brain.
Fog.
I was feeling that yesterday when I missed my flight. Biohacker.
Improving your lifespan.
Cool. Dentistry.
Biological.
And holistic.
Improving the whole body health.
Yes, definitely. The whole body. That's where we're going with that one. Doctor, this has been a pleasure. Thank you so much for being here. We'll share everything in the podcast notes, like I mentioned, so that people can either get in touch with you via social media. I'll add that as well as the download. So if somebody is interested in looking for that holistic dentist, they don't have to do so much research because you're helping them in that capacity. So thank you for being here. It has been a pleasure. And I'm looking forward to being on your show as well. So thank you for holding space for me.
Thank you. Appreciate that. It's been an honor. Thank you, Hilary. You're awesome.
Thank you. Make sure you download Dr. Pascal's list of what to look for when you are searching for a holistic dentist. It is free and can help you take a bite out of living well and finding the best dentist for you. That link will be in the podcast notes. You can also reach out to Dr. Pascal and find out more about his wellness center and his practice by visiting him on social media and also his website. I'll share those links as well. And if you need to find your calm before you sit in that dentist chair, just make an appointment to change your thoughts, your moods, and your behaviors with that dental experience and reach out to me. It was one of the first traumas that I resolved through havening techniques and using the modality, and I can help you do it as well. You'll find the link to Hug It Out on the podcast page. As always, if you know somebody that might find this episode helpful, could touch, move, and inspire them, could benefit them in some way, please pass it along and share your thoughts wherever you are listening, or even if you're watching on YouTube. I really appreciate it. I read everything. I'm always grateful for your likes, your comments, your shares. Basically just you. Music for the Holistically Speaking podcast was created and produced by Lipbone Redding, and this show was edited by 2 Market Media. So thank you. Take care of you. Remember, you are your own healthcare advocate first. Be kind to your mind. Don't forget to laugh. And of course, smile.
I know the girl